Today's question is, therapists, what is something people are afraid to tell you because they think it's weird, but that you've actually heard a lot of times before?
I work in an older adult service for people with dementia and mental health problems. I see a lot of family members, carers feeling ashamed of the fact that they are finding it incredibly difficult to care for someone that has dementia or a chronic mental health problem. Carer burnout is a real issue, and people need to know that it's not easy to see someone you love struggling every day or slowly fading away month by month. Carers and family members desperately need time for themselves and need to know that it's okay to feel the way that they do. No one is superhuman, and we all have our own needs. It's why we have therapy groups for carers. It's okay to struggle to look after someone, and you should in no way feel ashamed of having those feelings. Unwanted intrusive thoughts are normal and do not mean you are a bad person. Yes, even intrusions of sexual/religious/moral themes. By definition, these are thoughts that are unwanted BC. They go against your own values and highlight what you don't want to do, e.g., a religious person having unwanted blasphemous images pop into their mind, or a new parent having unwanted sexual thoughts about their new baby. However normal these thoughts are, over 90% of the population. The moral nature of these thoughts mean that often people experience a lot of shame and take many years before they first tell someone about them. Clients become quite fearful of admitting that they weren't successful since the last time they had a session. This could include not succeeding in using a coping skill that they're learning about, or not being able to complete a homework assignment I gave them. Humans aren't robots, and therapy is a lot of work. That being said, I don't expect people to be perfect as they start to work on themselves in a positive way. It takes time to really commit to change, especially in relation to trauma or conflicted views that an individual holds. I feel as if the client doesn't want to let me down as their therapist, but these failure events are just as important to talk about as successful moments. Psychologist in the US. To name a few: compulsive masturbation, fears of being a pedophile/rapist. This is a common OCD fear. Hoarding, sexual performance difficulties, history of sexual abuse or sexual assault. Unfortunately, it is very common. Drug use, amount of money spent on various things, having an ASD diagnosis, going back to an abusive relationship, staying in an abusive relationship, grieving years and years after a loss, self-harm of all sorts, wanting to abandon their current lifestyle, for example, to have more sex, to escape responsibility or expectations, history of gang violence/crime, their sexuality or asexuality, gender identity, the impact of racism, racial trauma, paranoia, hallucinations, feeling uncomfortable in therapy, not believing in therapy, difficulty trusting a therapist, fear of psychiatric medication, fear of doctors in general. I was surprised to see suicidal ideation on others' responses. Most of my clients seem to talk very openly about suicidal thoughts and urges from the start of therapy, which I think is super healthy. I think that most of the people I've worked with had SI, current or history. As weird as it may seem, I can't imagine what a life without any thoughts about suicide would even look like. At this point, I don't recall a time a patient said something in therapy and I was shocked or even thought, oh, that's new. And Imo, if you surprise your therapist, that is okay. I wonder if we asked Reddit, what are you afraid to tell anyone, even a therapist, because you think it is weird? How many people would see that they aren't that weird at all? The amount of people I see who feel like they should be grieving a certain way and are afraid that they must not have loved someone or must not have cared. People grieve in all sorts of ways. The 5 stages of grief are bullshit. I was consulting with another clinician who was seeing a couple whose daughter had died. The wife was convinced that the husband must not have cared about her because he wasn't grieving out loud. In reality, while she had been going to support groups and outwardly expressing, he had been continuing to work in a garden that him and his daughter had kept when she was alive, using that time to process and grieve as he did. Both were perfectly fine ways of grieving. However, it is expected that one's grief is more than the other. They both ended up working it out, however, he driving her and others to their weekly support group, her attempting to work in the garden with him on the condition that they didn't talk. Really sweet. To that same extent, the amount of people who are unaware of their own emotions and emotional process is astounding. So many people feel only angry or happy and worry something must be wrong with them otherwise. Normalizing feeling the whole gamut is just as important. Recognizing what we're feeling as well as what it feels like in our body when we're feeling is incredibly helpful for understanding how we process and feel. As a whole, how we treat emotions as a society is kind of fucked. Thanks for coming to my TED Talk. Patients have difficulty disclosing that they're victims of family psychological abuse and sabotages, since scapegoats aren't clued into the ongoing covert manipulative secrets. Scapegoated family members typically experience a lifelong dynamic of being abused/sabotaged, but scapegoats rarely understand the extent of their family abuse until they Google, "My mother hates me," or something as such, which provides some basic insight into things. We had one case where his mother and sister were contacting employers, friends, neighbors, etc., to slander that patient, thereby sabotaging almost every facet of his life. How? The sister and mother would pretend to care about the patient, enticing the patient to disclose details about his life. The sister would then contact whomever the brother recently discussed, employer, spouse, neighbor, to express concern or whatever to create a rift, tensions, between the brother and whomever the sister, mother had contacted. Graduate school, immediate boss, neighbors, etc. The result was an endless series of losses incurred because the mother/sister team were relentless, which thereby created paranoid symptoms in that patient, when in reality, the mother/sister were contacting whomever possible to cause problems, fights, divorces, pet thefts, job losses, between that patient and whomever possible. Throughout his life, the patient had heard from friends, spouses, etc., that the mother and/or sister had made contact and slandered, but the patient failed to connect his biggest losses with the deliberate mother-sister sabotaging efforts. The patient's experiences were easily confirmed through more than one person whom the mother and/or sister contacted. The patient provided a list of names, etc., one of which is now an MD, who talked about being contacted during in their undergraduate college days. The mother would call the now.d while they were on campus and during school breaks. It was weird. The mother would talk to me like we were friends or something, said the former college friend now.d. I'm convinced that same dynamic exists for many mentally ill individuals, meaning that paranoid symptoms exist because someone, sister, mother, refuses to stop covertly meddling with the life of the targeted victim. Some of these have already been said, but these are the ones that are very prevalent in my experience. Thoughts about what it would be like to harm/kill someone. Thoughts about people close to you getting in an accident, dying as a result. Parents who have thoughts about not liking their kids or regretting having them/wondering what life would be like without them. Spouses, parents imagining what it would be like to just walk out on their family. People often find it difficult to admit they are really lonely, but specifically college students, young adults are ashamed by this. Hearing voices, seeing things that aren't there. Suicidal thoughts. Anything that has to do with sexual behavior and fantasies, thoughts. Jealous thoughts about how you sometimes hope that maybe a friend breaks up with their sign other, loses their high-paying job, etc. So many of these things are just normal human thoughts, and you don't have to feel bad about them as long as you can reflect on why you feel these things and don't really plan on acting on them. Other things are symptoms of mental health problems that have historically brought a lot of stigma with them, and people are afraid what others will think. My advice: research your psychiatrist and the practice they work for. Ask them questions about their thoughts on certain subjects, experiences with problems that are important to you. Treat a first meeting with a psychiatrist like a job interview. You are hiring them to help you, so you need to be sure you can trust them. 1. Gay thoughts. 2. Abuse. 3. Racism. Edit. I have gotten requests to open these 3 thoughts, so the following is just that. Gay thoughts are natural. The problem is what is socially acceptable to express and what isn't. It is socially acceptable for 2 women to kiss, but not 2 men. Many times I have to talk with male clients about being comfortable in their skin and talking about the attractiveness of human beings. The curvature of a woman's body is lovely. A strong jawline is extremely attractive. It's okay to find someone of the same sex attractive. More than likely, when you talk about it, you can move on from it. Many clients talk to me about abuse as I am a trauma therapist by nature. I will keep this short and sweet. If you have trauma and you are looking to get over it, you need to answer one question. What would my life be like if I absolved myself of all my trauma? I try to help most of my clients understand the abuse they suffered was not their fault. In short, hurt people hurt people. Racism is a very twisted and toxic thought process. It's essentially saying, because I look a certain way, I am superior. Many of the clients I work with talk about race for one reason or another because, like it or not, we are all impacted by race. Racism was and still is a vital part of the American society. With my white clients, the questions are something like, is this racist? Have I been racist to you? Am I a bad person for thinking this? Am I a racist? How do I not be racist? The answer to these is yes. You are 100% racist. The structure of America is set up in a way that benefits white skin in particular. This is how the systemic racism works. On top of this, you need to realize racism has been around for over 400 years. It's not going to just magically go away because of 60 years of civil rights movements. However, in my view, the problem is, many white people think being racist means they are bad people. This is false. Being racist doesn't mean you are a bad person. It means you lack the insight to have empathy for a race other than your own.
Tatsok.
Usually that is solved by just getting to know more people of the race you lack empathy towards. Many of my white clients who are racist towards black people get off easy because I myself am black. I make a good starting point for them. The most common one that clients see is too embarrassing to bring up in therapy is having sexual/romantic thoughts about me. Often they will wait till we're almost done with therapy to bring it up, and we'll have a good chat about how normal it is. One guy said it seemed odd to him at first, since he's pretty sure he's straight. Over time, he realized he's not accustomed to feeling loved/accepted. He was initially unable to conceptualize it outside the realm of sexual attraction. I can think of one counterexample of a therapist in training whose client said that he compulsively masturbates to slash on food. It was one of the student's first clients, and he got very uncomfortable. It probably says something that I have to go to an example of a very new counseling student who ended up deciding therapy is not for him. To find an example of a therapist being shocked, we hear people's deepest secrets all day. Humanity is beautifully weird, and we will celebrate all your hidden quirks with you. They probably won't surprise us, though. I work as a therapist at an addiction treatment hospital. Usually the stuff that people seem to be most embarrassed to tell me are related to how far they have gone to obtain X substance, or how they are really struggling to handle everything emotionally. As you can imagine, most of my clients have been through some really serious shit and aren't afraid to talk about most of it. But when it comes to stuff that shows personal vulnerability, like being depressed when their friend owed, or having to preform sexual actions for drugs, it takes a while to build that level of trust to where they feel ready to talk about it. This extends to more mild populations as well. In general, I've come to believe that people are quick to talk about what happens around them, but don't always feel safe talking about what is going on in them. At the end of the day, every single client I have had says they are so relieved to finally get something off their chest. I'm always like, You've told me about all the fucked up shit that people have done to you. It's normal and natural for you to have reactions to it. If anyone reading this is in therapy and is holding something back, I politely implore you to let it out. That's what therapy is for, and we are trained to be non-judgmental and accepting. In my experience, it always leads to some really great discussion and seems to only strengthen that therapeutic relationship. I think the hardest thing to admit is having an addiction when you're deep in the addiction, or it's your only coping mechanism to deal with the other disturbing things in your life, whether it's abuse or mental illness or post-traumatic stress. You know, for a lot of people who suffer from addictive personalities, your body naturally wants to do things that give you that dopamine rush or that serotonin ush or whatever other relaxing endorphins you create while doing the activity you are addicted to. And in my case, the hardest thing for me to admit was I really did have binge eating disorder, because all throughout the practice of the disorder, I consistently talked myself into all my destructive behaviors by rationalizing them as helpful or rewards for having a bad day or nutrition, because if I ate a certain food, then it would do something for me and make me a better person. I also had a tremendous amount of negative feedback going on in my head about food having much more power than it really did over me. And that all started with my mother, who had an eating disorder as well, and who starved us sometimes as kids. I developed genetic disorder that's caused by mothers starving themselves in pregnancy, actually. It makes me gain weight easily and have a high level of testosterone, and that only made it worse for my mother because she simply couldn't control my weight through any normal natural means. The roughest thing is no one, including weight loss surgery doctors or the counselors they employed, ever once suggested or considered this was a problem with my condition. I had to go to an actual eating disorder clinic with a doctor who specifically treated people and a nutritionist who is specifically trained and a counselor who all work together as a team. So in a lot of ways, these addictions, especially the non-evil ones like gaming addiction or gambling addiction or sex addiction or food addictions, are our last fortress of protection against the really bad things that happen that we're trying to cover up very deep in our subconscious and deep in our traumatic memories. After I finished my psychology degree in 2012, I started learning a little bit more about childhood post-traumatic stress and a lot more about how it actually affects your development of your brain chemistry. It is worth a read. But developing an addictive disorder is often a coping mechanism for that post-traumatic stress, because it soothes that need within a child that the parent cannot soothe, or the emptiness that the parent's behavior has created. In food addiction, it's one of the hardest things to admit, because it's one of the easiest things to access to soothe bad feelings and to protect yourself from outside attention. And the related disorders like anorexia and bulimia are simply all manifestations of the same pathology, no matter if the patient is fat or thin or average. Don't be afraid to talk about it, but I do suggest finding a proper eating disorder therapist before pursuing weight loss surgery, or if your control of your weight is dominating your life to the point where you feel that it's the reason why you can't do all the things you really want to do. Clinical therapist here in private practice. This is a topic that has interested me recently, and I've spoken about it several times with my wife, who is a school psychologist. We're a funhouse. As a therapist, it's important for me to really consider the form of question asked and how to answer said question. Words not only have meaning, they carry strong connotations that may be misleading or misinterpreted, especially in a text-only forum. I think this question might look slightly different at its core. How I understand it is, what are some topics that individuals struggle or hesitate to disclose, but are actually somewhat common issues? I don't mean to change the question at all, and I really hope I didn't hear. I agree that fear plays a role for some individuals, and for others it might be anxiety or a feeling of shame. They might hold back because they think it's weird, or they might think I'll think it's weird. For the record, absolutely nothing is weird to a decent therapist. Some might worry they'll be judged, treated differently, or reported to the police at times. Only imminent harm to others or self can break HIPAA, not other crimes. I believe that individuals hesitate to talk about certain topics or episodes because these incidents become much more real when they are discussed. They are not ready to deal with them in a meaningful way yet, and that's okay. Denial and other psychological defense mechanisms are in play. Starting where the individual is means not rushing the process. Building trust and a safe place to talk about these issues is what therapy is in essence. This brings me to the last part of the question. What issues are they mainly? I see many therapists on here identifying these topics, and we can see the range of them. From sexual assault, victim and perpetrator, to abortion, religious guilt, and thoughts of harm, whether they be passive or active. The heart of this question, I think, are which of these topics are common, and therefore, which of these topics should the individual feel less hesitation to discuss? Normalization, or normalizing experiences, is one of the most important components of therapy, letting another individual know, through empathy and understanding and an absence of surprise and judgment, that how they felt and how they dealt with the situation is not only understandable, but normal or a common response, allows these events to be broken down and processed further. It does not matter if I have heard something similar, or whether this is my first time dealing with a particular topic or incident. All topics are okay to talk about because they are all a part of the human experience. All events are normal in that someone has likely gone through it, or will be through it sometime in the future. We all have unique stories, but in some ways, everything is common to a degree. This is the paradox of human experience, and what can unite us ultimately if we empathize with others. And this is the end of today's video. I hope you liked it, and don't forget to comment an anecdote or experience similar to the topic of the video. Leave your like, share if you like the video, and lastly, don't forget to activate the little bell so you don't miss any of our daily videos. Bye-bye.